name is Dr. David Levine, and the date today is April 9th, 2022. I'm in San Diego at the American Association of Plastic Surgeons meeting, and I'm here as an interviewer for the ICON project. In a nutshell, this project, sponsored by the Society, is to preserve in an audiovisual fashion icons of plastic surgery. They can be innovators, teachers, academicians, anything that has contributed to our field that has advanced it to the point that it is today. I'm fortunate here to interview Dr. Bob Russell, who is at a professor at Southern Illinois University right. And has had over 30 book chapters and is past president of the American Society of Reconstructive Hand Surgery.
American Association for Hand Surgery,
okay.
American Society for Reconstructive Microsurgery.
We have a lot of names, don't we?
We do. Peripheral Nerve and the Educational Foundation. I guess it's not educational anymore, it's just a foundation.
Yes, okay. Well, this used to be a joint project, but now it's just the association.
Right.
And you serve, yes, director craniofacial volunteer, and now volunteer on Operation Smile. Let me ask you a couple basic questions, and I would like to get into that since you said you have a passion for that. Would you state your full name, please?
Robert Charles Russell.
Date of birth and parents' names, wife, children.
Okay, July 13th, 1945, so I'm 76. My father and mother were Helen and Harry Russell. My dad was taught flying to pilots that were going to the Second World War.
Wow.
Actually in biplanes. I saw a picture of him with his biplane. And he actually went to college, was the first guy to graduate from college in our family, and he was a teacher. So he taught the apprentice training program for General Motors for a while. He was a draftsman and so forth. Anyway, so he was also a person who wanted you to study and work hard. So he was basically one of the reasons why I did okay in school. So, because I knew he was watching.
And you grew up where? I can't.
Mansfield, Ohio.
Okay. Okay.
And I actually got a football scholarship to play football at Indiana University. So he didn't have to pay for me to go to school.
That's right.
Yeah.
Were you an All-American?
I was, yeah.
See, I remember that
That's
from
good,
Google. Yeah. What position did you play?
I played offensive guard.
Okay.
And we played against O.J. Simpson in the Rose Bowl. So that was Indiana's only Rose Bowl team. So I still have a footprint in here if you want to see it from O.J.
Really? And did you mention your family, right? Your children?
My wife is named Ann, and I actually met her at the American Association for Hand Surgery meeting. She was working for Wally Chang, and in those days that association didn't have a central office. Each president kind of did the work for a year with his office staff. So he brought 2 or 3 of his office staff to the meeting. And so the joke is she checked me in, and that was the end of me. So anyway, I met her when Wally Chang was the president of the Hand Association, and he was in Seattle. So actually. And
what year did you say that was?
Oh, he's going to get me in trouble now.
Oh, okay. I thought you might have mentioned. I didn't remember it. So. Okay, it's not a quick.
All right, I have to look that one up for you. It was in the 80s.
Now, how did you decide to go into plastic surgery?
Okay, so because I played football and everything, I actually had knee surgery and some other things. I was thinking about being an orthopedic surgeon. And a lot of jocks, go into orthopedic surgery. But then I was at the General Hospital for my general surgery residency, and Elvin Zook was there at the time. He'd just become the new chief of plastic surgery, finishing his residency at Indiana. And so I got to start doing some cases with them, and I really liked it because plastic surgery was the only specialty where you could actually put something back. Everybody else took everything out.
Mm-hmm.
Plastic surgery, you could actually fix it or make it or put it back, and that just the aesthetics of it, or the ability to three-dimensionally think, is what I liked. So that's what happened.
Well, it's interesting you say that, because I think that a truly successful plastic surgeon is immediately attracted to what plastic surgery is, the art part of it. And I can't wait. I'm going to interview Dr. Burt Brentlater, who is a part of his life is art. But I think it's a nice combination of intellectual as well as physical prowess to do what we do.
Yep. We've had several of our residents who are good artists, and I actually give preference to somebody who interviews and tells me that they can paint and draw, because that means they know where everything's supposed to be. So
Yeah,
I think that's a really good quality to have as a plastic surgeon.
And mention a few more of your mentors, if you wouldn't mind.
Okay, so what happened is I started out in Indiana in plastic surgery. I actually got fired, interestingly enough, over a case. But anyway, I wound up taking a hand fellowship at St. Vincent's after that year, and that was with Jim Strickland and Jim Steichen, and they're pretty prominent role players in my life. I learned a lot from either one of them, different things. One guy had a very serious, precise personality. The other guy was more of a jovial guy and, didn't take himself too seriously, and that's an important quality, I think, for some people to have. We're all not as important as we think we are, I guess is one way to say that. At any rate, then I learned hand surgery from them, and then I wound up going to Southern Illinois with Zook as a resident in plastic surgery. So I learned plastic surgery from him. And the guy that was with me in general surgery at Wishart Memorial in Indianapolis was a guy named Alan Van Beek, and he was the resident ahead of me at Southern Illinois. So he was my chief resident both times.
Okay.
And so it was kind of like a family, because we all, he and I had both already been trained in hand surgery. He went to Louisville for a year, and I went to Indianapolis.
Under Kleiner?
Yes. So Zook just didn't have to do anything. He just kind of sat back, and when the hand cases came in, we had two guys that could do the hands. And that's really how all the microsurgery and all that started, because we were trying to do that in the lab, and we were trying to do clinical cases, and so we gave all the ambulance drivers cards of how to take care of amputated parts. And pretty soon the floodgates opened, and
Of course.
we were getting parts from Iowa, and there was no place in St. Louis or Chicago, so
Sure.
we were it for the whole state. So believe me, Van Beek and I have sat up a lot of nights together over a microscope. So.
Well, it started out in the microsurgery, I guess basically I finished my residency in '75. I think I did a hand fellowship in Akron City, and we did a replant, which we should have never done, by the way. It was a PIP joint amputation, and nowadays.
Well, we have indications of it, but in those days we didn't have any indications.
Well,
Tried everything.
The guy he said, "What do you think I should do?" I said, "I think you should throw it in the trash." Yeah. But he wanted, because that's what he wanted to do. 7 hours later, you know what happened to a lot of those distal
if
joints.
you got a 4-finger amputation, that's 12 hours, 15 hours of surgery.
I learned there that I didn't want to do microsurgery.
Yeah.
Nothing personal. Anyway.
We didn't have duty hours then either, so if we stayed up all night, you still had to work.
That's right. That's right. And they were long evening. Anyway, it's another story.
Yep.
So you see momentous shifts and paradigm shifts, in plastic surgery during your illustrious career. Have we discussed mainly with microsurgery other things you'd like to talk about?
Well, when I started, they were just, actually when I started, there were no CAT scans or no MRIs, just used x-rays. I think one of the things that's changed is our ability to process or get information. We used to have to go to the library and go to the card catalog and find the journal and go in stacks and find, So now you just go on Google or PedMed, and you can see a video on how to do a procedure. You can see before and after cases. You can read somebody's paper. That's a huge change from when I started anyway.
Yeah, no, and that's part of the purpose here is preserve audiovisual. We have access to so much now in learning.
Well, guys used to come to the meeting, with carousel of slides, or they actually had cases you could carry like 5 or 6 carousels at once. And, the joke. This is again Strickland, who was the comic, you know, a guy of the hand surgeon. I was giving a talk one time, and he came up in front and said, "Hey, the guy in the back just dropped your slide here, son.
Oh,
I think he got them all back in the right place." And I'm like, panicked, you know, but it was just a joke. You know?
Yeah.
But anyway, things have changed now.
Nobody has those anymore.
No.
In fact, they're probably, you could get them on eBay and they're more expensive because everybody got rid of their slide projectors.
Well, you don't want to be as a projector anymore, even any of that stuff.
yeah, it's all digital.
All right.
What do you feel has been the most important innovation in our specialty? Again, we may have touched on it with microsurgery, or would that cover it?
Well, I think a few things have changed. I think probably the biggest breakthrough was when Ian Taylor and the guys described angiosomes and venosomes, and that made us understand the circulation of all of the skin everywhere. So we knew where all the blood vessels were. And that led to free flaps, skin flaps, muscle flaps, propeller flaps, I mean, all sorts of things, because once you knew where everything was, and you also could explain why the tip of your flap turned blue. You know, when I was first started in plastic surgery, we had all these length-width ratios we were supposed to remember.
Paper, yeah.
And that was all complete baloney.
4-to-1, 3-to-1.
Yeah, that didn't have anything to do with anything. But that's what they taught you. Actually, I told somebody the other day when I first started medical school, the dean of the medical school came and he said, well, 30% of what we're going to teach you is going to eventually found out to be wrong. Problem is, we don't know which 30%. And that's
true.
I didn't know what he was talking about at the time, but that has proven to be true.
Yes. What do you feel is your greatest professional accomplishment?
I don't know. I like to say that we built a really solid program at SIU, actually with Zook and I and Van Beek to start with. And we actually made the place fairly well known. You know, it was a new medical school. Nobody knew anything about it. And just by doing good work and having a microsurgery research unit and giving papers and everything, pretty soon people, you know, knew where SIU was. And the other thing I think I'm most proud of is all the residents that we trained. You know, we trained 5 presidents of the Hand Association, 2 ASPS presidents. One of our residents is going to be the Aesthetic Society president next year. So I think we've had 3 or 4 microsurgery presidents, all from the little tiny.
And so how many residents have you trained in total? Do you know?
I don't know. It's probably 80.
Okay.
Yeah.
Okay. And most of those going to private practice or academia?
Oh, it's about 1/3 into academia and 2/3 into private.
Okay. Can you tell me anything about your greatest disappointment in plastic surgery, or do you have any?
No, I've really enjoyed being a plastic surgeon. I think I don't have too many disappointments. I interviewed a couple times to be chairman, and you know they didn't select me, but probably I would have been all right as a chairman someplace. I was going to be actually chairman of surgery at the City of Hope, which is not a great place for plastic surgery. And actually Neumeister was going to go with me and be the chairman of plastic surgery. But the guy that was going to hire me was a guy from Houston, and he somehow got fired between the time that he offered me the job. And I never did know why. But anyway, I bought a house in California, and the guy said, well, you know, things have changed a little bit here. And so I said, well, okay, you guys owe me some money, and you just bought a house. So I didn't go there, but that would have been a big change in my life, because that would have been a lot of research. They had a huge research budget and a big research facility, and you know that's where Humulin was actually invented.
What was invented?
Insulin, human.
Oh, okay, okay.
At the City of Hope Research Lab.
Interesting.
So, yeah.
Okay, we'll talk about more positive things, and talk to me a little bit about Operation Smile.
Okay. So when I was a resident and early attending, one of our residents was a guy named Craig Merrill, and he actually went out to practice with Bill McGee on Charlie Horton at Norfolk. Mm-hmm. And about a year after he was out there, he called me up and he said, hey, there's these guys that are starting this thing called Operation Smile, and it's pretty good. You might want to think about going on it. So that's Bill and Kathy McGee. And then they actually they actually offered me a job to come to be in that program. That was when Julia Terzis was there and everybody. So I didn't take the job, but I got to meet Bill and Kathy McGee, and I was pretty impressed with the whole thing. So I started going on these trips with them. And I probably done 40 missions or something.
Wow.
Over the time. And, it's a wonderful experience for the residents. We are able to take residents now because Bill got funding from some foundation to take the residents. At first he didn't think that was a good idea, but I said, you got to stock the pond. These are the guys that are going to do this later.
Right.
And now he's, close to my age. That'd be a good guy for you to interview, by the way. And he realizes that is what we need to do. We got to have the young guys come along who are excited about taking care of people in third world and whatever. So, and the other thing that's changed for Operation Smile is they used to just be Americans, go and do surgeries and come home. Well, now there are volunteers from all over the world that go on these trips. I mean, you might have an anesthesiologist from Spain and a nurse from, wherever. And surgeons from all over the world come and do this. So there's some terrific cleft surgeons around the world. I've been with people like in Vietnam. This one lady can do a cleft with her nurse in like 20 minutes just because she's done, that's all she does is clefts. And it looks perfect, good nose, everything. So actually, I always learn something, a little trick on every one of these trips from one of the other guys that are there, So, and now that we can take residents, you can get almost a whole residency number of cases in a week.
Yeah, which you could never do at a small with any program.
No.
Is it 1 in 650 births? Is that the number? You're not going to see that many cliffs in a 2-3 in a year.
It's impossible. Yeah. So they get a really good exposure, and also they get to see not only what I know about it, they get to see what the guy from Peru knows about it or whatever. So they get to learn from all these guys. So the residents are just blown away by the experience. So it's a really good thing.
I think that's great. And it's funny because I had never seen it before, but there's been advertising on TV for Smile.
There's Smile Train and Operation Smile. Smile Train is different.
That's why I got confused. Okay, so Smile Train is different.
Smile Train was started. It used to be the same people, but what happened was a guy named Charles Wang of Wang Computers in China. When McGee was going to have his big anniversary year, he wanted them to come and do a train that had surgery set up in it. And what they did instead was they got Billy Graham's airplane or something and did surgery and flew around on the plane, went to different places. So that made the guys in China mad, so they started Smile Train, and of course he has unlimited money to do whatever he wants. So that's a different group. And they actually pay those guys to go on the trips, the surgeons.
Interesting.
Option Smile is you don't get paid, you're a volunteer. Maybe buy your plane ticket, but
politics.
Well, it's the same everywhere,
Yeah, right. And it's all local. So who would you say you admire most, professional or personal?
Well, I would say Elvin Zook is somebody that really, he was the guy that trained me, but, if you look at him as a person, he was a terrific chairman. He was a great teacher. He was a good husband, a good father. He raised 3 girls, 2 are doctors, and 1's a nurse. He pretty much did everything well, and so that would be somebody wouldn't hurt yourself to emulate. And he just died a couple of years ago now.
Right.
But that's somebody I look up to, and also I would have to say Bill McGee, the guy that started Operation Smile. He does all this for completely the right reasons.
And where is Bill McGee now?
They're in Virginia. They used to be in Norfolk, but now they're at Virginia Beach. That's where the Operation Smile headquarters is.
Okay, interesting. All right.
I'll tell you a good story about Operation Smile if you want to hear one.
Yes, I would love to.
So we had a guy that, we were in Kenya, so everyone has tribal languages in Kenya, And this guy walked for 2 weeks to come to the hospital from a far off place. So when he got there, nobody could speak his language because each tribe has their own deal, So we put him in the hospital, but he had a bilateral cleft lip. He looked like a big rabbit. He was like 21 years old. So oh yeah, we got to do him. Okay, so we put him on the schedule every day, and they always do the young kids first. So we never could, because the turnaround was kind of slow at this hospital.
Right.
We never could get to him. So finally, next to the last day, I went to the head nurse and said, "Listen, we got to do this guy. Just put him on the table, do him under local." So Alan Seifer and I, who was a chairman of plastic surgery at Oregon at the time, just put him in the room. The guy laid down on the table. We stuck all these needles in his face. He never even flinched. Okay. Did his surgery, and when he got down, he looked like pretty much every other Kenyan. They have kind of a flat nose anyway. So
Cleft
anyway,
lip nose.
so by this time, we found a nurse who could speak his dialect. So we sat him up on the table, gave him a mirror. He starts crying, looking in the mirror. So the nurses are crying, everybody's crying. So now I got this nurse that can talk to him, so I'm ready, say, so what do you think? I'm like, okay, man, I'm ready, I'm gonna really, this is gonna be great. So he said, blah, blah, blah. So what did he say? She said, I get me a wife. That was it.
Yeah. Hey, you
I
changed
know.
his life.
Well, when you think about it, the guy's probably never been kissed.
Yeah, right.
I mean,
Well, in foreign countries,
so
it's an anathema.
yeah.
They're considered.
Their parents sinned or something.
Right, exactly.
So that's a
exactly.
complete, huge change in, hour of surgery. So interesting.
Yeah, I love it. That's a great story. Give us some words of wisdom for present and future generations of plastic surgeons.
Well, that's a tough one. I think one of the things that I've seen happen is there's more and more, there's less and less availability of doctors. When I try to get an appointment with an internist for one of my patients, they tell you things like 2 months. I said, now I want you to see him tomorrow. What are you talking about?
Yeah.
So one of the things I think is to continue to be available. You don't have to see a cosmetic patient next week, but you should. If somebody has a real problem, you need to see him today or tomorrow, or don't put it off. Don't be like the other guys. The other thing I think is important for young guys is to be nice to their staff, nice to everybody around, because just because you're having a bad day doesn't mean everybody else should have one. So they're all there trying to help you, and so you should try to remember that when you are having a bad day.
Yeah, I think those are great words of wisdom. Okay, last question, and then we can, anything else you want to discuss after that. This new meeting is unique in that we've lived with COVID for 2 years. Mm-hmm. And my question was, and obviously last year I wasn't able to make the meeting for medical reasons. The year before, nobody made any meetings. Mm. And so essentially we lost a period of time. And I was wondering in January of 2020 was the first COVID case. We still deal with it now. Just had a function that was canceled.
Not going to go away.
I know that. That's another story. Yeah, it's here forever.
It's here forever.
But how did the lockdown affect your life, and how did you adjust to it? And your thoughts about that.
Well, my hospital actually closed the outpatient surgery center, which I never could figure out why they would do that, because if the beds are being taken up by COVID patients, they're not being taken up by outpatients. So anyway, we were for about 1.5 years. We couldn't do any cases, so that kind of affected me financially. The interesting thing is, though, I don't know what's happened in your practice, but because of the government money, I guess, when the doors finally did open, it was like, everybody and his brother wants something done now. I mean, I think I'm booked out for 3 or 4 months, which usually is not the case. And it's almost all cosmetic, which is something that I started out being a microsurgeon, hand surgeon, but as your practice matures, you wind up doing more cosmetic because you get those patients from other patients.
Right.
So one tells the other one, and pretty soon you got a waiting room full of people who want something.
When you mention, first of all, I'm retired, and glad that I did. Just somebody said, "You have any regrets?" I said, "Yeah, I wish I'd done it a year earlier." And that's just because, and I was talking to Dr. Bentz, who was here before you, said you got to have a plan when you go through this. But for people doing plastic surgery, in particular aesthetic surgery, they said their practice, once this was, quote, over. He said it'll never be over completely. Their practices went crazy. Everybody wanted it. I guess they got tired of
Well,
being
they got money
cooped up.
from the government. They got, all of a sudden they didn't have to work anymore, and again got paid, and just I don't know what happened, but I don't know if it's going to last or what's. Maybe the bubble's going to break. I don't know, but interesting.
Well, and the other thing I appreciate when you said about the trips, which I think is so important now, and you alluded to it, getting trained in plastic surgery is learning everything.
Yeah.
And it drives me crazy when guys want to come out and be a cosmetic surgeon with social media. And one day they're the expert.
Oh,
And they got Instagram. and
we've had a couple of residents do that. So.
And I think,
Despite our best efforts.
I understand that. But I'm thinking, you've trained in a beautiful field with so much you can do.
Yeah.
And your first step is, I want to be known as a aesthetic or cosmetic surgeon. And to me, that was secondary. I'll tell you a story after the interview,
Okay.
which I can't talk, but I had a similar circumstance that you had in your residency.
Yeah.
But the thought I had then was, I want to know everything about plastic surgery. And I did a hand fellowship afterward. It was the one thing I didn't get enough of in my residency because I didn't want to go to emergency room and be ill prepared.
Yeah, I did mostly hand surgery until the last maybe 10 years, then it just kind of slowly morphed into what I am now. And now I
Yeah.
only do about 20% hand surgery. So the other thing that's changed is the politics of medicine. In our town we have two big gorillas. We have the Springfield Clinic and we have the medical school. So neither one of those places can give me a patient. I'm not allowed to. So if I want to get a breast reconstruction, I have to get it from a surrounding town. The only reason I get those things is because I've been around there a long time. So in the old days, people used to come to you because you were the best doctor. And that's got nothing to do with it anymore.
Yeah.
That's out the window. So,
Where do you see plastic surgery in 25 years?
well, I think we're going to still be around. We're going to still be useful. I don't think we're going to be able to make your face look better with a pill. I don't think we're going to be able to make your tummy smaller. I don't think we're going to be able to put your hand back on with a pill. So there's going to be a place for us. There's going to be more and more competition for cosmetic things because, the reason we have American Board of Medical Specialists, and we're to protect the patients, not the doctors. And what's happened now is that everybody wants to be a plastic surgeon because there's this cosmetic bunch of patients who are money up front. So we have facial plastic surgeons, dermatosurgeons, and all different kinds of aesthetic surgeons.
Sure.
And it's all for that share of the market that pays up front. So I think we're going to see more and more of that as time goes by. And how we handle it is another question, I think we should just keep our standards high and keep trying to show that there is a difference between somebody who's actually trained as a plastic surgeon and somebody who just says they're a plastic surgeon.
Right. Well, we've had that discussion before, too,
Yeah.
with other plastic surgeons.
Yeah.
It's been a pleasure, Dr. Russell, to interview you.
Thank
and
you.
by the way, I interviewed Dr. Zook early on in this process.
Oh, did you really?
Yes.
Oh,
I can't remember if he was one of the first group,
I'm glad
but he
you
was.
did.
Yeah.
That's very
well,
important.
that's, so we have him for posterity.
Oh, that's wonderful, yeah.